Behind hospital walls, nurses say they face a crisis, overworked and understaffed.
It's every time you go to work, you're planning to be there for at least 16 hours.
A nurse from Upstate Golisano Children's Hospital sat down with CNY Central under the condition of anonymity, concerned the hospital would fire her. She says Upstate is cutting corners to accept more patients than nurses can safely handle.
A staffed bed doesn't exactly mean a safe staffed bed.
An Upstate spokesperson tells me the hospital's 2,000 total nurses can maintain a 4 to 6 nurse per patient ratio. This nurse says she's handling almost the opposite, dealing with 5 to 6 patients at a time.
I'm rationing care every single day. I'm choosing who gets to see me for an appropriate amount of time and who doesn't. And it's, how do you make that choice? These are people, these are kids. Some of those children are supposed to be in the ICU, but the ICU is full, so they're on the regular floors, but you're forced to care for them in this regular assignment.
Because you're not specifically trained to work in the ICU.
No, I'm just a regular nurse.
But you're taking care of patients that need ICU care.
Yes.
We asked Upstate if the way things are being run inside is actually safe for nurses and their patients. They got back to us in a statement declining an interview, saying they're down 400 nurses and have reduced bed capacity by 20%, which they say ensures safety, something they call a top priority.
It's not working. It's not very safe.
This nurse describing a different reality, dreading the thought of going into work each day.
Have you considered leaving?
Yes.
What's keeping you there?
What happens to my kids if I leave? My patients if I leave? There's one less nurse. What happens to my colleagues if I leave? They have to take on my patients.
She says she's taken these concerns to managers and isn't getting help. Upstate spokesperson says mandates, essentially forced overtime, are common when there are shortages, and says we understand the impact this decision has on nurses and their families and are grateful for their understanding when this occurs.
A lot of the answers are there's not much we can do. We're a state facility. We're the only children's hospital for a large number of counties. We can't close any more beds.
According to Upstate, the problem is they can't compete with lucrative traveling nurse contracts. A spokesperson says the hospital has already increased overtime pay and base wages.
Yes, they need to be paid more.
Governor Kathy Hochul promising to address wages for nurses in her upcoming State of the State address. Upstate says they're eager to see the plan, hoping for help to address the staffing shortage. This nurse says not only do wages need to go up, they need legal protection to ensure safe nurse-to-patient ratios.
They cannot have more beds open if they don't have the nurses. And so they're going to be forced to hire more nurses and at what it costs.
Upstate says physicians and nurses work continuously to provide care as the region's only trauma center. But this nurse says they're failing to do it safely. And other nurses we spoke to off camera at other Syracuse hospitals say it's the same story everywhere. Too few nurses taking care of too many patients.
We're failing them. We're not offering them care. I love my job and I'm honored that I get to take care of them, but it's very hard to do it.
Did you always used to feel that way?
No.
In Syracuse, I'm Connor White. It's the first day of classes in the Jordan Elbridge School District.
When we opened up last fall, the infection rate was very low. We didn't have our first case for 6 weeks. I hope that we're that fortunate again as we reopen.
19 of their staff members will need a negative COVID test to come to work because they're not vaccinated.
We have tests that are provided to us from Onondaga County, and we'll test every Monday morning in our nurse's office.
The county mandated weekly testing for unvaccinated staff first.
The kids, specifically the kids K through 12, have had no choice in this process. You, the adult, had a choice. You, the adult, if you work in a school district, were able to be almost first in line for the vaccine.
The state followed and said schools need to make on-site testing available.
I think it's something that really provides reassurance that our staff are going to be at work as much as possible.
Liverpool Superintendent Mark Potter is expecting to have to make sure around 100 unvaccinated staff members are tested weekly.
We're going to do what we need to do as a school district to provide the adults for our kids. I think that's my role.
A spokesman for Onondaga County says they will be using rapid tests already on hand, secured with pre-approved funding. In the Syracuse City School District, around 80% of staff members are fully vaccinated. But as of today, there are around 752 who are not. And each week, they're going to need a test that looks something like this. And if they're coming from the county, they're going to cost $5 a pop. Meaning each week, just over $3,500 worth of tests will be used here in the Syracuse City School District alone for unvaccinated staff.
We support the vaccine. Vaccines are incredibly important, has been widely useful. We also support the need for some people to go through and recognize that weekly testing is going to be the option for them for so many reasons.
North Syracuse Teachers Union President John Carilla says testing needs to be an option, saying a vaccine mandate would lead staff members to quit.
Carving away populations of people who can work with children who are certified to do so at a time that we already have a staffing shortage would be devastating to our system.
Onondaga County Health Commissioner Dr. Indu Gupta says the unvaccinated staff across the county are putting their students at risk.
Adults have the choice to get vaccinated. They are there to protect, whether it's a parents, it's a grandparents, teachers, because that's what their job is, to protect the vulnerable, and kids are vulnerable.
The county and the state using millions of dollars worth of tests to ensure that protection is still there, to help ensure your children are safe in the classroom. In Jordan, I'm Connor White. Police surveillance cameras keep watch throughout much of Syracuse, but you won't find any here on Furman Street. Neighbors say that's a problem.
During the day, it's pretty safe. I think it's in the evening and at night is when people feel that they can get away with things.
David Pilch is the director of Adult and Teen Challenge, an organization that helps fight drug addiction. His hope is that cameras on the street would have helped prevent these bullet holes, still in his organization's sign from when it was hit by stray gunfire last year.
It's something that's necessary as there's more lawlessness in our community.
Syracuse police claim cameras can help deter crime and can be crucial tools in investigations.
We've had homicides that have been solved solely on those street cameras, meaning that we didn't have any witnesses come forward, we had no citizens come forward, we really didn't have anything to work off of.
Syracuse Police Deputy Chief Joseph Cecil was part of the start of the camera program over 10 years ago.
They have been what I would call immeasurably helpful.
A tool that you paid for. Each unit costs between $12,000 to $15,000 in funds from New York, secured by state representatives, meaning the 521 cameras citywide arrived thanks to $6 to $8 million from taxpayers over a 10-year period. When they start to hit their shelf life of about 7 to 10 years, the city of Syracuse is then on the hook for maintenance. In 2020, the Syracuse Police budgeted for $150,000 to repair aging cameras, and they used every dime. In 2021, the budget is now $175,000, and that may fall short.
Don't know if that'll be enough. A lot of them aren't breaking completely. They just need to be repaired. We can't afford to have some of them down.
This as the push for more cameras continues. Right around the corner from Furman Street, the Blue Star gas station on South Salina is looking for cameras on their block.
They got a lot of shot here, always. We call somebody, you contact the police, we want to put camera in the street.
But not everyone in Syracuse thinks that cameras are the full solution.
These people don't care about cameras. If they're going to do something, they'll do it. Sure. But it might help a little bit.
I still truly believe that other things should be done along with it.
The police department admits that cameras aren't as effective as adding more police patrols, but claim with 40 staff vacancies, they simply don't have the numbers to put more officers on the street.
Nothing prevents crime like having officers patrol your neighborhoods, but if you can't get to that point, then these cameras are the next best thing.
An expensive plan B that Chief Cecil says Syracuse police have no plans of getting rid of. In Syracuse, I'm Connor White.